I will build a bit on the complexity of the notion of spirituality, with particular attention to this kind of shared notion that I think that we're building, that spirituality is first and foremost about creating a vision, a way of understanding, a meaning-making kind of paradigm in which we not only understand ourselves, who we are, what we are, but you'll see I always move to the moral, and how we are with each other, or how we ought be with each other. So for me, spirituality is not an individual personal reality. The more deeply spiritual I think you become, the more interconnected you become, not only with other persons, but I think with reality, with creation. So that's why when Brother Tom asked me if I'd come and do some talks, the first one I knew I wanted to do what I said yesterday, which is let's reflect a little bit on the language of spirituality and the complexity so that we can be attentive and respectful of its diversity and complexity. Today I want to propose that we can't do spirituality unless we are compassionate. And I'm going to suggest, again, because of my interest in language, that we then better understand what compassion is. So I'm going to try this morning, in the time we have together, and we will have time for interaction. So I've never done this before. This is where I'm moving myself personally in linking compassion to spirituality, and I'll be interested to see what your insights are about whether this makes sense or not. So, I got a little flipper here. Why would we have concern for compassion as a particular focus in the 21st century? As you see, I'm talking about the notion of compassion. And I would suggest to you that some of what our own experience in our own lives, the lives of our loved ones, or the lives of those whom we've served as patients or clients, depending on how you see them, should make it clear that the world in which we find ourselves in health care, now again, hold on to Nuala's distinction between health and health care. I'm going to come to health, but our focus, and remember I'm a former pediatrician, chief of 2 children's hospitals. I love the technologic. I love fixing stuff. I love it when you have children that were sick and you did your best and the whole team helps and you're there with the balloons when they go home. I mean, there's nothing, you participate really in God's life-giving force in a way that makes you quite humble. But what I want us to reflect on is when we think of health in the 21st century, in Canada, in the developed nations of the world, but Canada, the United States, we have a tendency immediately to go to health care. And to go to health care and health narrowly construed. All right? And in that focus, then, we, I think, have been overwhelmed by visions of reality. Remember? We're thinking of spirituality giving you a vision of reality, a way of understanding things. But modern science and technology, as a byproduct of its success, has bred or contributed to a very technologic, commercialized, and individualized notion of health and health care. Care is care to individuals. Care is the intervention. It is the machine. It is the tube. It is the drug. So you have persons who will come to a physician and they'll come back, they say to me, Nuala, I had to wait, 3 weeks to see this specialist and she didn't do anything. Meaning, she didn't write a prescription, she didn't send you for an MRI, and she didn't refer you to another specialist. All right? Now let's assume that there are times when it's appropriate to not refer you, to not give you meds, and to not do more investigation. But we've so equated care with the interaction with the technology, that I think part of the ways we nudge each other towards the spiritual is by becoming attentive to the lack of other values. And for me, compassion is a big, when we feel compassion, we're moved to understand the spiritual. When we fail to appreciate or experience anything like compassion, we move to the technological, to the individual, and to a very reduced notion of who we are as human beings and how we ought to be with each other. So I think there are lots of reasons in our world to give special attention to compassion. Now I want to tell you what compassion isn't, because it is like the word spirituality. We have persons who talk about compassion and they ain't talking about compassion. Compassion is not mercy with its sense of forbearance and leniency. Those of us who believe in God, for example, we talk about a compassionate God or a merciful God. But mercy, while it has some similarities to compassion, it has an element of judgment that is different from compassion. More specifically, as an error, compassion is not empathy. We sometimes think that a little bit of fellow feeling, trying to get inside the skin of those whom we are attempting to assist, trying to understand what it is that they are suffering, that is compassion. Now hold that thought, because we're going to see it is an element of compassion. But empathy, or the attempt to experience and develop the capacity to feel with another, is not compassion. It's the first movement in compassion. Okay? And definitely, compassion is not sympathy, which is what most of us think. You feel sorry for, and you think that is a feeling of compassion. And clearly, it's not pity. And pity is an important notion, but if you really think of it deeply, and a number of theologians have written about pity, there is within the notion of pity a sense of inequality. You pity those who are kind of, it is a sense of experience of the suffering of others, but those others are not like us. There's always an inequality in pity. So I just want you to think just for a minute, again, as with spirituality, when you hear the word compassion, I mean, there are elements of all these other understandings that come into play, I think. And think of others that you might incorporate.